3 dry fruits before bed to treat arthritis, science-backed relief. For the over 240 million people worldwide living with osteoarthritis, and the millions more struggling with rheumatoid arthritis, the quest for effective relief often leads to a medicine cabinet filled with painkillers and anti-inflammatory drugs. Yet, emerging research from leading arthritis specialists and institutions reveals a surprising ally in this battle: a simple dietary intervention involving dry fruits consumed before bedtime. This isn't just folk wisdom, it's science-backed nutrition that targets the very mechanisms driving arthritis pain and progression. The concept of using food as medicine for joint health isn't new, but recent groundbreaking studies have identified specific dry fruits with remarkable properties that may help manage arthritis symptoms. When consumed strategically before bed, these nutritional powerhouses work overnight, when the body does most of its repair and regeneration, to combat inflammation, protect cartilage, and potentially even reverse bone loss. This essay explores the compelling scientific evidence behind 3 specific dry fruits that arthritis specialists are increasingly recommending as part of a comprehensive arthritis management plan. Science behind dry fruits and arthritis relief. Arthritis encompasses over 100 different conditions characterized by joint inflammation, pain, and stiffness. The 2 most common forms are osteoarthritis, OA, a degenerative joint disease involving the breakdown of cartilage, and rheumatoid arthritis, RA, an autoimmune disorder where the body attacks its own joint tissues. Both forms involve significant inflammation, though their root causes differ dramatically. Recent research has revealed that rheumatoid arthritis begins long before symptoms appear, with dramatic immune system changes occurring years before joint pain manifests. This discovery highlights the importance of early intervention and prevention strategies, including dietary approaches that can modulate the immune system and inflammatory responses. How dry fruits combat arthritis. The biological mechanisms. Dry fruits contain concentrated levels of bioactive compounds that target multiple pathways involved in arthritis progression. Anti-inflammatory compounds. Dry fruits like prunes and berries are rich in polyphenols, flavonoids, and anthocyanins that reduce inflammatory chemicals in the body. These compounds have been shown to decrease tissue swelling, edema, and inflammatory molecules in joint fluid. Antioxidant protection. The antioxidants in dry fruits help fight cell damage that wears down cartilage. They neutralize free radicals, unstable molecules that contribute to and worsen RA by damaging the body's cells. Bone and cartilage support. Dry fruits provide essential minerals like potassium, magnesium, and selenium that contribute to healthy bones and cartilage. Some, like prunes, have been shown to help preserve bone mineral density, potentially translating to fewer bone breaks. Gut health benefits. Prunes and other dried fruits feed beneficial gut bacteria, which may lower overall inflammation in the body, a crucial factor in autoimmune conditions like RA. A 2024 Mendelian randomization study published in the journal Medicine provided compelling evidence for a causal relationship between dried fruit intake and reduced osteoarthritis risk. This sophisticated analysis of genetic data from thousands of people found that those who regularly consumed dried fruits had a slightly lower risk of developing OA. Top 3 dry fruits for arthritis management. 1. Prunes. Dried plums, the bone preserver. Scientific evidence. Prunes have emerged as perhaps the most researched dry fruit for bone and joint health. Multiple studies have demonstrated their remarkable effects. A 2022 study published in the American Journal of Clinical Nutrition found that eating 5 or 6 prunes a day helped postmenopausal women preserve bone mineral density in their hips, which could translate to fewer bone breaks. Research indicates that the daily consumption of prunes lowers inflammatory chemicals that contribute to bone breakdown, making them particularly valuable for those with inflammatory forms of arthritis. Animal studies have shown that dried plum has a pronounced effect on bone in terms of both prevention and reversal, as evidenced by higher bone densities, mineral contents, and percent trabecular bone area. Key active compounds. Prunes contain a variety of phenolics that work synergistically to enhance bone formation and inhibit bone resorption. They're particularly rich in neochlorogenic acid and chlorogenic acid, which act as potent antioxidants. Recommended consumption. For bone and joint benefits, research points to 5 to 6 prunes, approximately 50 g, consumed before bed. This dosage has been shown to be effective in clinical settings without causing digestive issues for most people. 2. Dried figs, the mineral powerhouse. Scientific evidence. While less extensively studied than prunes specifically for arthritis, dried figs offer nutritional benefits that directly support joint health. 2 dried figs contain approximately 65 milligrams of calcium, a crucial mineral for maintaining strong bones and preventing the progression of osteoarthritis. Figs provide substantial amounts of potassium and magnesium, both of which contribute to bone density and may help counteract the acidic conditions that can leach minerals from bones. The fiber in figs may help lower levels of C-reactive protein, CRP, a key marker of inflammation in the body. Key active compounds. Dried figs contain bioactive compounds similar to those in other dried fruits, though their particular strength lies in their mineral profile. They offer a complementary approach to prunes by providing essential building blocks for bone repair and maintenance. Recommended consumption. 2 to 3 dried figs before bed can provide meaningful mineral support. They can be eaten whole, sliced, or blended into a small pre-bedtime smoothie. 3. Dried berries, the inflammation fighters. Scientific evidence. Berries in dried form, including blueberries, raspberries, strawberries, and cranberries, concentrate their anti-inflammatory compounds. In a cross-sectional report among patients with RA, participants identified blueberries and strawberries as high on the list of anti-inflammatory foods based on disease activity scores. Animal studies have shown that raspberry extract significantly improves clinical symptoms of arthritis, including tissue swelling, osteophyte formation, and decreased articular destruction. Blueberry extracts have been demonstrated to cause approximately 30% decrease in tissue swelling and edema with a concomitant decrease in inflammatory molecules. Key active compounds. Berries are rich sources of anthocyanins, the pigments that give them their vibrant colors, which are powerful antioxidants that can fight free radicals and help lower inflammation. The anthocyanin content varies by berry type, with darker berries typically containing higher concentrations. Recommended consumption. A quarter cup mixture of dried berries before bed can provide therapeutic benefits. Look for unsweetened varieties to avoid added sugars that could promote inflammation. How to incorporate dry fruits into your nighttime routine. Timing and preparation tips. Consuming these dry fruits approximately 30 to 60 minutes before bedtime allows their bioactive compounds to work in sync with the body's natural overnight repair processes. The digestive system continues to process these nutrients during sleep, when the body focuses on regeneration rather than daytime activities. For enhanced benefits. Soak prunes and figs in warm water for 15 to 20 minutes before eating to soften them and potentially increase nutrient availability. Create a balanced arthritis relief mix combining all 3 dry fruits in the recommended proportions. Pair with a small source of vitamin C, such as a few slices of orange, to enhance mineral absorption, particularly the iron from dried fruits. Portion control and considerations. While dry fruits offer concentrated nutrition, they're also calorie-dense due to water removal during the drying process. A typical quarter cup serving of dried fruit contains approximately 100 calories and 17 to 24 grams of natural sugar. Stick to the recommended portions to avoid excess calorie intake while still obtaining therapeutic benefits. It's also crucial to note that dried fruit should supplement, not replace, fresh fruit in your diet. The USDA considers a quarter cup of dried fruit equivalent to 1 fruit serving, and most adults need about 1.5 to 2 cups of fruit daily. Complementary lifestyle strategies for arthritis management. While dry fruits can be a valuable component of arthritis management, they work best as part of a comprehensive treatment approach. Medical supervision. Never use dietary strategies as a substitute for professional medical care. Always consult with your healthcare provider before making significant changes to your diet, especially if you have underlying conditions. Appropriate exercise. Low-impact activities like walking, climbing stairs, gentle aerobics, and using elliptical machines can strengthen bones without excessive joint pounding. Weight management. Maintaining a healthy weight reduces stress on weight-bearing joints, potentially slowing arthritis progression. Additional anti-inflammatory foods. Beyond dry fruits, Consider incorporating these science-backed anti-inflammatory foods into your overall diet. Fatty fish, salmon, herring, and sardines provide omega-3 fatty acids that research shows can help lower inflammation and reduce RA pain, swelling, and stiffness. Beans, packed with fiber and protein, beans may help lower C-reactive protein levels while supporting muscle strength around joints. Green tea, rich in polyphenols that may lower inflammation and slow cartilage destruction. Extra virgin olive oil contains numerous polyphenols with anti-inflammatory properties. Conclusion: the incorporation of specific dry fruits, such as prunes, dried figs, and dried berries, into a nightly routine may provide relief and protect against arthritis progression. These fruits, backed by research, help preserve bone density, reduce inflammation, and offer essential minerals for joint health. While not a standalone solution, they complement conventional treatments and contribute to an overall anti-inflammatory diet, affecting joint health and quality of life positively. The growing research underscores the importance of diet in managing chronic conditions like arthritis.